God, my head is paining. Child, are you struggling with headache? Yes, Swami, yes. Then take this medicine. Hey guys, just now I had an headache, so I took a headache medicine. So after a while, I felt very well because I don't know what happened inside, but it worked well. So then I wondered how these work, how these medicines work. Just after taking a headache medicine, it worked very well. What is the inner mechanism in it? So that's the agenda behind this video. In this video, we'll see how these medicines work, I mean headache medicines work, and what's their inner mechanism involved in our body. So without delay, let's get into the video. So basically headache is four types. Number one is tension based headache, which means we get this headache because of lot of stress and pressure and tension. So what are the symptoms of this headache? How do we know this is tension based headache? So the normal symptoms of this tension based headache is it's a bilateral, which means we'll have the headache on both sides, and it's non-pulsating, which means we won't have that nerve or blood vessel pumping outside. We can easily feel just an headache and not that blood vessel outside. That's non-pulsating and it's common for tension based headache. And the headache what we will be feeling will be mild and moderate. It won't be that much severe. And how do we know it's mild and moderate? Means with this headache we'll be able to work and do other activities also. We won't stop other activities because of this headaches. It will be normal and not that much severe to stop our activities. So that's why it's called as mild and moderate headache. And these type of headaches will be there for just a while, which means hardly 30 minutes. So this is called tension based headaches or tension type of headaches, first type. Now the second type of headache is migraine. So now migraine, how do we know this is migraine type of headache? Means the characteristics of the migraine type of headache is it's either bilateral or unilateral, which means we'll have on both sides or either single sides. And these type of headaches are very severe. We won't be able to do any other activities when we have this headache. It will be that much serious. And one feature which separates this migraine headache with tension based headache is that it's pulsating, which means whenever we have migraine based headache, we can feel that blood vessel pumping out. We can literally feel that blood vessel outside. So this is the main characteristic to differentiate tension based headache and migraine based headaches. Other than this, migraine based headaches will also have other symptoms, which means sensitive to light, sound, nausea and vomiting. Whenever we exposed to light and sound, we feel so irritated. We are like, just stop it, So in that way we'll be. And other than that, we also feel like vomiting, that's called as nausea, and also we vomit sometimes. This is migraine headache symptoms. Sometimes migraine headache comes with aura, which means before the headache comes, we can feel that vibes. We can literally feel that headache is gonna come. So that kind of symptoms includes vision blur. We feel blurry vision and flickering of light. The light in front of us will shake, waves we can see, and numbness and disturbance in speech. We can't speak properly when we feel this migraine aura. So this is the second type of headache, migraine headache. And the third type of headache is cluster headache. So this is kind of severe headache, and this will be unilateral, which means we'll have headache on only one side, and that will be very, very severe. And other than that, we also feel pain around our eyes, other sides of our face, and we also experience swelling of eyes and eyelids. So these are the other symptoms of this cluster headache. I swear with this cluster headache, we won't be able to do any other work. So that much serious it will be. All we need will be just rest, that much painful it will be, and this is called as cluster headache. The fourth type of headache is medication abuse headache. As name says, the medication abuse headache means we will be taking a medicines for several days, several months and years. We'll be continually taking a certain medicine for some reason. Let's say for migraine, we'll be taking medicine continually for many years, and suddenly at one day we'll stop taking that medicine. At that day we might feel this headache, and this is called as medication abuse headache. And don't take it seriously that it happens only for the people who might be taking medication. It's quite normal because every one of us experiences this at one point of life. How? Let's say Many of us will be taking coffee every day at specific time, isn't it? So but one day if we stop taking that coffee, we will feel headache, isn't it? So that's called as medication abuse headache. So other than these four types of headaches, normal headache and headache itself a symptom for many other diseases. So this is the major four types of headaches, and sometimes we will get headache because of some other diseases also. So in this video we're not going to talk about any of that headaches. We will be completely focusing on one type of headache, and that is tension based headache, because that's the most common headache and most people will be facing that kind of headache in this pandemic. Before knowing how these medicines and medications in the market work against tension based headache, we should know how this tension based headache is caused in the first place. So I won't bring these medical terms into the slot. I'll explain very simple way. So let's say I'm a person who is responsible, and because of my personal problems I went out and created a big issue. Kind of I pissed off all the street members or society in my place, and I came home. So everyone in that society is very angry now. So after knowing that they're very angry, what will I do? I will send my friends somebody, and then I'll tell them to go, bro, see something happened over there. I think they're very angry with me. Settle that issue and come. No, I'll send them. What these idiots will do, these people will go, they'll speak with the top heads in that society, and they will piss them off more. No wonder, because they are my friends. So because of that, the whole society will become more angry and they want to take revenge on me. So the whole society angry will be so much that we will get headache. In simple terms, the problem what I created here, my external problem, is nothing but my external situations causing lot of pressure to the brain and the tissue over there. So that is nothing but a society or street here. Now because of my external problem, the brain is already pissed off. So after knowing that my brain is pissed off, our body, what it does, it releases compounds called as prostaglandins. These prostaglandins are generally released in all the time, but it is released, the synthesis is increased more when there is an imbalance in our homeostasis, which means our body will try to bring balance between any activity inside our body. For example, if I run, my heartbeat increases. After that it will come back to normal, isn't it? So same way, since I'm feeling a lot of stress, my body thinks maybe releasing prostaglandins might settle the problem. But unfortunately, this prostaglandins goes and pissed off this big heads. It's nothing but the myofascial tissue and the myofascial receptors in the brain. So once that myofascial receptors get activated because of this idiot's prostaglandins, we get headache. And that's how it works, as simple as it is. So now we know how the headache is caused. It will be easy for us to know how the medication will work in settling this issue. Most commonly used headache medicines are balms or tablets, isn't it? So the most common balms are Jandu balms, Amrutanjan balms, Vicks vapor rub, etc, etc. So let's talk about these balms first. So now whenever we consider Jandu balm or Vicks vapor rub or anything, the main ingredients in it are menthol or essential oils, we call. So the essential oils can differ. It can be peppermint oil, it can be eucalyptus oil, it can be lavender oil, etc. Now whenever we take these main ingredients and rub it on our forehead, what it does, these main compounds, the main ingredients in these balms will go and it will relax that myofascial tissue. It will relax that tissue. It's nothing but it will relax that society and the bigots, saying that chill bro, it's happened, whatever happened is happened, take it easy. So this is what we can do, you relax. So this way these balms will cause relaxation in our muscles, in that tissue, and because of that our headache will fly away. So this is how the balms work. So the second most common medicines for headaches is tablet. Basically there are three types of tablets available, and we refer pain relief tablets because it's a pain, isn't it? So pain relief tablets we'll use to treat this pain. So the most common pain relief tablets we use to cure this headache is aspirin, ibuprofen and acetaminophen, which is also known as paracetamol. So let's talk about aspirin and ibuprofen. So these two are called as NSAIDs, which means non-steroidal anti-inflammatory drugs. Since the headache is caused because of the stress, pressure, and that prostaglandins released, and these prostaglandins caused inflammation in our, that tissue, these drugs will control that inflammation. So that's why it's anti-inflammatory drugs. So what it does, let's talk about aspirin. What it does is, it will go and it will block the prostaglandin synthesis. It will be like, these idiots are the reason behind this headache. So let's stop this prostaglandin so these headaches will get cured. That much. That's the only simple thing they do. So now how much time it will take to reduce this, to synthesis of that prostaglandin is 20 to 30 minutes, because it's a tablet, right? We'll take that tablet and it will get digested, it will reach that place, it will do that settlement, all that stuff. To show and to perform all this work, it will take just 20 to 30 minutes for this tablet to show action. After 20 to 30 minutes, we will be free of this headache. That's how these NSAIDs are, this aspirin and ibuprofen both work. The side effects mainly for these aspirin and ibuprofen is rashes and GIT problems. We might feel the burning sensation and pain in our stomach at GIT. And also we might have headache again, which means we'll take this medicine to treat headache and again we'll get that headache back. This is a side effect of these tablets. And we sometimes might have nausea and vomiting, which means we might vomit or we might feel like vomit. And the most common side effect of these drugs are blood thinning agent, which means generally whenever we get any accident or whenever we cut our finger, something like this, so the blood will come out for some times and that it will stop at certain point, isn't it? The blood clot will happen and that blood clot will stop that blood coming out, but generally. But if we take this NSAIDs continuously, if we take this aspirin and ibuprofen continuously, every day, what it does is it will decrease our blood ability to cause this blood clotting. So because of that, if just normal cut happens, also lot of blood will be coming out, and that's very dangerous situation to be considered. And it also affects kidney, heart and heart related problem patients, and that's the reason why these drugs are not prescribed to the patients who have heart related problems and kidney related problems. So NSAIDs are not suggested for the people who have kidney related problems and heart related problems such as high BP, etc. Now the third drug is acetaminophen, also known as paracetamol. Comparing with the NSAIDs, paracetamol is most safe and effective in lesser doses only, and this paracetamol also will work on the same mechanism, such as it will inhibit the synthesis of the prostaglandin in the body. So same way it will work, but paracetamol is much safer than the NSAIDs such as aspirin and ibuprofen. The most common brands for paracetamol varies. We might know Crocin and Dolo, all this stuff, isn't it? The brand is your wish, because all it got is paracetamol only. All will work almost a similar way. So that's it guys. After this experience, I understood how the medicines in the market, how the headache medicines in the market works properly, and I hope even you guys understood it, how they work. The money knowledge and the medicine knowledge is very necessary for all common people outside. Not only money related experts and medicine experts should know that. Everyone should know what they're taking and how they work. That's the agenda of this channel, and I hope you guys will like it. So please subscribe my channel for more these kind of videos, and let me know what kind of disease we should talk and etc, etc. So share this video with your friends and family and support this channel. See you guys in the next video.